Hello and welcome. Today, we're going on an architect's tour of one of the most recognizable and important bones in your entire skull. So what do you say? Let's dive right in. So let me ask you something. Have you ever really thought about the bone that's right there forming your entire forehead? It's just one single shell-shaped bone, and today we are going to explore every last detail. And here it is, the frontal bone. It creates the whole front and top of your cranium, and its main job? Well, it's a big one. It's the protective shield for the frontal lobe of your brain. You know, the part that's responsible for your personality, for planning, for so much of what makes you, you. To really get a handle on its brilliant design, we're going to break it down into its four main sections. There's the big squamous part, the two orbital parts, and then the nasal part right in the middle. Let's start our tour with the part you see in the mirror every day. So, the squamous part. This is the largest section by far, giving us that broad, curved forehead. You can think of it like the main facade of a building. It's the first thing you see, and it gives the face its whole shape. Now, what's really cool is that the squamous part has two totally different sides. On the outside, the part that faces the world, it's convex, it curves outward. But flip it around, and on the inside, it's concave, curving inward to create this perfect, snug cradle for the front of the brain. Let's take a look at the outside first. Your forehead isn't just a blank slate. It's sculpted with all these amazing features. You can actually feel some of them. Go on, feel that bony ridge right above your eyes. That's the supraorbital margin. And sitting just above that, you've got the superciliary arcs, which is just a fancy way of saying your brow ridges. Then, way out at the sides, you have the zygomatic process reaching out, almost like it's shaking hands with your cheekbones. Every single bump and curve has a purpose. Okay, so we've seen the public-facing side. Now for the backstage tour. Let's spin this bone a full 180 degrees and check out the internal surface. This side is a totally different landscape, designed specifically to interact with the brain. Right down the middle, you can see this vertical groove. It might not look like much, but it's a custom-built channel for the superior sagittal sinus. That's a huge vein that helps drain blood from the brain. As the groove heads down, it gets sharper, forming a ridge called the frontal crest. And right at the very bottom, there's a little pit called the foramen cecum. It's incredible how every feature is designed to work with the brain and its plumbing. All right, let's move down from the forehead. Our tour now takes us to the orbital parts. These are these surprisingly thin, yet incredibly strong roofs that are built to protect each of your eyes from above. What we're looking at here are two thin, curved plates. Now, they don't actually touch each other. They're separated by this U-shaped gap in the middle called the ethmoidal notch. And that notch is the perfect docking station for another piece of the skull puzzle, the ethmoid bone. If you look closely at this surface, you'll see some really fine, important details. Out toward the side, there's a little depression called the Lacrimal Fossa. That's home to your tear factory, the lacrimal gland. And then more toward the middle, you have the trochlear fovea, which acts like a tiny, perfect pulley for one of the muscles that helps your eye move around. And the design just keeps getting better. The very back edge of these orbital plates forms this perfectly straight line where they connect, or articulate, with the sphenoid bone sitting just behind them. It's like a master carpenter's seamless joint. Next up on our tour is the smallest, but you could argue it's the most central piece of the puzzle, the nasal part. I like to think of it as the keystone in a stone arch. It locks everything together right at the bridge of your nose. So this little section actually forms the border around that ethmoidal notch we saw before. And its most obvious feature is the nasal spine, this sharp little projection that points straight down and helps build the upper part of your nasal cavity. But there's a secret hidden in here. On each side of that nasal spine, there are openings that lead into the frontal sinuses. These are basically hidden, air-filled rooms inside the bone itself. You've got two of them, a left and a right, separated by a thin little wall called a septum. Okay, take a breath. We've looked at all the individual blueprints. Now let's pull the camera back and see how all these parts, the squamous, the orbital, and the nasal, come together to form one single, absolutely elegant structure. So let's recap. You have the massive squamous part giving you your forehead. You have the delicate orbital parts creating a safe roof for your eyes. And you have the sturdy nasal part anchoring everything right in the center. Altogether, they form this unified bone that's both a helmet and the very framework of your face. We've seen just how intricate this single bone is all by itself, but that just opens up an even bigger question, doesn't it? How does this one amazing piece of architecture fit and work with the 21 other bones that make up the skull? Well, that's a tour for another day. Thanks so much for joining me.